Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crow, Director of Professional and Community Education. I am so thrilled today to have two wonderful guests on this program. Today, we're going to talk about cardiac disease and the needs of individuals and families who are living with cardiac disease. So we have Cynthia Ayu, who is the Senior Director of Clinical Services, and also Kristen Schaefer, Dr. Kristen Schaefer, I should say, who is the Medical Director in the Greater Boston area. Welcome to the program.
Thank you, Mary.
We're really thrilled to have you guys. I'd love for each of you to tell a little bit about yourself, a little bit about your background, and also what you do at Care Dimensions. Cynthia, do you want to start?
Sure. Thanks for having us today, Mary. This is really exciting for us to be here to talk about cardiac disease. My name is Cynthia Ayub, as Mary introduced me. I have been here at Care Dimensions for the last 11 years and been doing hospice for 17 years. Been a nurse for over 30 years with a lot of experience in cardiac disease as well as home care and hospice.
Did you start at age 6, Cynthia?
I did. Thank you very much, Mary. Thank you.
Kristen.
Hi, Mary. Thanks for having us here today. I am a hospice and palliative medicine physician. Before that, I was a primary care physician for years. And now I've been working in hospice and palliative medicine with a special interest in heart failure for many years. So Cynthia and I love working together and love a chance to talk about this. My role in the past, I worked for more than a decade with an advanced heart disease team in a hospital as their embedded palliative care physician. And so I thought a lot about what patients who are sick with heart failure, sick enough to be hospitalized, really needed and wanted in the face of their serious illness while they're in the hospital, but also to get home and have good care at home. So now I'm very pleased to be working at Care Dimensions and with our cardiac program to be able to offer high-level care.
That's wonderful. Thank you so much. I am so thrilled to have you both here because this is a big deal, right? So I want you to really share some information and facts on cardiac disease because I don't know if people understand the magnitude. So Cynthia, do you want to start?
Sure. One thing that I did not really realize, I mean, I have a lot of experience, but heart disease touches every family in America. And it affects more 1 in 3 adults and kills 1 out of 4, the most of any of our diseases that we see.
Wow.
That's a very serious problem here. And COVID-19 has increased premature deaths due to patients with heart disease not seeking treatment. So
that's a big deal, isn't it?
Yes.
I don't think we understand the magnitude of this, right? Is that here we have, obviously this has been a very tough year, hasn't it? Year plus, actually. And when we hear the numbers of people who have died from the pandemic, but I don't think we're not factoring in these numbers of people who haven't sought medical treatment for other illnesses.
Right. And on an average, only 50% of heart failure patients who would qualify for hospice care are enrolled.
Okay.
And so on an average of 5% of patients discharged from hospitals with heart failure are enrolled in hospice care. Mm-hmm. So that's underutilized, this wonderful benefit that we have to offer to patients and families.
Yeah, that's really important.
Yes.
And that's what we'll talk about this more because I want you to go in a minute too, but I want to just talk a little bit too with Kristen about, what are some of these particular needs? Because, I think that you really have to look disease specific, don't you? Because every illness has its own special set of circumstances and how it impacts individuals and families, doesn't it?
Yeah, that's really true, Mary. Couple things about heart failure. One thing is that usually people who have heart failure have had it for years. Not always, but often. People have it for a stretch of months to years to many years. And one of the things that patients and their families with heart failure need is often some education and understanding about what the trajectory of heart failure really looks like. so that they can understand and be prepared for the future with their heart failure. We know that heart failure usually presents with a crisis, or people are very short of breath and get diagnosed with heart failure. Then they develop a relationship with a primary care provider or a cardiology provider. They go on medicines and they do well. They might even forget they have heart failure at the beginning of heart failure, right? Because they're on good medications and over time, a long period of real stability. Then as heart failure progresses, patients often have periods where they get really sick and go into the hospital, and then they bounce back almost to how they were before. So there's this way that heart failure has a kind of 9 lives quality to it, that, you're really sick and then you're taken care of and kind of return to your normal health. So again, a sense of like, this isn't really something that's going to kill me. This is something that I have to manage. Unfortunately, there becomes a turning point in the trajectory of heart failure towards the end stages of heart failure, where now patients start getting sick and going into the hospital, and they bounce back, but not quite to where they were before. And it's uncertain. It might happen a lot in 1 year. It might happen once in 1 year. And then all of a sudden, a lot of hospitalizations or problems in a couple months. But what happens as heart failure gets worse is people's exacerbations come more frequently. They're worse. And it becomes harder and harder. People lose ground on their kind of baseline health and function at home. And so that's where we focus in palliative care and heart failure. And hospice and heart failure, is to really try to enter patient and families' lives at that time of the trajectory of heart failure, when symptoms are getting worse and the disease is really starting to be a burden on their quality of life. Because we know patients need symptom management. Shortness of breath is the obvious symptom of heart failure, and we use medicines for that. But patients with heart failure also have pain and depression and insomnia that we can help with in terms of really addressing those symptoms and helping people live well, even though their heart failure is progressing. And then patients and families, in addition to symptom management, often need information about kind of with their other doctors and their hospice and palliative care doctors to think about, where are we with my illness and what lies ahead, so that patients and families have a chance to make plans ahead about what kind of care they want as they get sicker, and what's important to them to be able to do and prioritize in their lives if their life is going to be limited by the heart failure.
It really strikes me when you're talking, it's such important information that you're both giving. You can see how a serious illness unfolds, can't you? And then as you talk, it's almost like this roller coaster ride, and these levels, as you talked about, the uncertainty. That I think that word is so important, because advanced or serious illness does lead to a lot of uncertainty, doesn't it? And you talked about how things get, the periods of exacerbation are shorter. And then also and I loved how you talked about palliative care when they come in, because it's helping with the pain and symptom management, but there are so many other losses and changes that happen for people too, with roles and other things, and how it affects even work and a lot of different things. It can affect people's socioeconomic status. And I think that, again, that's where I think palliative care probably is a big benefit too, don't you?
Yeah, I do. And also just to note that the way hospice and palliative care works best for heart failure patients and families is in true collaboration with the doctors who know that patient best. Sometimes patients are afraid or worried to ask their cardiologist about, what to expect moving forward, even, how much time do I have left with this heart failure? Do you really think it's going to take my life? And what should I expect? Those are conversations that we know when we study patients' experiences with heart failure, that they actually do want to have that conversation with their cardiologist or primary care doctor, someone who knows them. And so that's one of the other things that we can do in our area of expertise, is help patients and families figure out what they need to know and how to get that information and have good conversations with the other members of their team.
I love why you keep bringing up this team, because it is when people have a serious illness, one of the first things you do is start building your team, right? And that consists of your primary, it consists of specialists and a lot of other people, whether it be informal or formal support systems, don't it? And then you have to, and including palliative care too, right? How to bring your all of these people together to be your main supports through a process like this.
And just to say, Cynthia's going to describe more about this amazing cardiac care program that we have at Care Dimensions. But one of the things we've done is built algorithms that look like they are endorsed. They're the same algorithms and treatment plans that cardiologists and primary care clinicians use to treat shortness of breath and heart failure. So we're developing the same expertise of how to use the same medicines to help people get their fluid off, get their breathing better. And then we have an additional layer of interdisciplinary expertise to really care for and support the patient and family holistically as well.
Nice. Excellent. Cynthia, talk to us. Tell us about the cardiac program.
So the cardiac program here at Care Dimensions has been in existence since 2012. And we offer to our patients a daily check-in call. So we have a lovely lady that checks in with our patients and families every day to see how they are feeling, how's their shortness of breath, how are their shoes fitting today, how did they sleep, anything going on, are they having any pain, so that we can quickly identify when they start having some symptom issues that we can head off at the pass. I like to use that word a lot. You know, we try to avoid the crisis before it happens. We also offer telemedicine, telehealth, which is a way to monitor a patient daily, blood pressure and weight and how their oxygen levels are. Along
house, right? So tell a little bit more, just explain to the audience too, because you know this is a community group too, Cynthia, just about what is telehealth and what does that mean, a little bit more if you don't mind.
Sure. It's really cool to use the technology, and it's like having the nurse and the physician right there in your home with you. So they answer these really pointed questions that we ask every day of how they're feeling, and they tap on a tablet. It looks just like an iPad size. It's very small and easy to use, and there's hardly any wires to it. It all connects to each other, and then all that information that they put in there gets uploaded to a nurse who's sitting there looking on the monitor, and they can see, oh, their blood pressure is a little elevated today, or they've gained a couple pounds overnight, and they'll call Mrs. Smith and say, how are you feeling today? I can see that you've gained some weight. She might say, oh, we went out for some dinner last night, and that might be the reason why your weight is up, or she may be feeling very short of breath. And we could reach right into our nurse, their primary care nurse, to go out and see them out in their home or assisted living, wherever they are, to really assess them and call the physician and get some new orders if they need that. So it's a wonderful program that we offer. And then we have some wonderful education booklets that we provide, and it helps with the family caring for their loved one. You know, you're a daughter and a nurse all of a sudden, taking care of mom and dad at home. And so you have lots of questions and you may need some guidance as well. So our whole interdisciplinary team is available: social worker and chaplain, volunteer, music therapy, massage therapy. So there's lots of needs for the cardiac patient. And most importantly, our hospice aides to help with some energy conservation, to help so that you're not wasting all your energy taking your bath and getting dressed, that you could use your energy to visit with your daughter or your grandchildren and really live and have some rich quality of life. Instead of being in the hospital and really feeling ill. And so that's what we strive to do every day, and help to empower the patient and the family care for themselves and understand what's happening with their body.
That's great. I love how, again, you're bringing up this, the family, right? Because we focus on the individual, the patient, and we should. But we can't forget the family caregiver, can we? And meeting when I say family, I mean anybody who loves and supports that person, right? Because that's who family is. But we don't want to. I love how it's really you kept mentioning it, how we're focusing on the whole crew, the whole team that way, because it really does affect everyone, does it?
Sure does. The patient and the family always need to be the focus of our care. It's not just the patient. There's a lot that goes into keeping their loved ones supported at home, to be where they want to be. And it's a lot emotionally, it's a lot of physical care. And so to have hospice there or palliative care to be supportive helps along the journey, helps us to walk beside the patient and the family.
And people don't want to be bouncing back and forth, do they?
No, they really do not. We hear a lot from our patients to say, I was afraid to come onto hospice, afraid of the word, afraid what it meant. And they'll say, I don't know why I waited so long. You guys are wonderful, So we hear that oftentimes from patients and families, that they feel like they waited too long to access the benefit.
Jump in, Kristen.
Oh, one of the things I was going to say that we know that another thing that patients and families worry about, patients, first of all, are scared that they're not going to be able to breathe, right? They're scared that they're going to feel like they're suffocating towards the end of their life or at any time. And you know what? Families are really scared of that too. Patients are scared. I don't want my loved one to worry watching me like this. And families worry too. Like, it's such a helpless feeling to think that their loved one could be having, very, very short of breath. So we do a lot of contingency planning around that. We have medications in the home that we teach the patient and family that is there in the home for them. If the shortness of breath acts up in a severe way, they can call our triage nurse 24/7 for Care Dimensions and get help. The loved one can get help of how to deliver medicine to the patient so that those symptoms will really ease down and be controlled while we send a nurse and, while they're waiting for a nurse to come out and see them. But we do contingency planning so that people know they're prepared for that. They also know that if needed, they can come into one of our hospice houses for subcutaneous or IV medications to try to get on top if the symptoms, shortness of breath, for example, is very out of control or not controlled at home. They know that's a resource for them too, to be able to come in and get more intensive inpatient hospice care to get the symptoms under control. We do contingency planning because we know it's a worry for patients and families.
I think that's important too, right? Because, and you're talking about getting the symptoms under control and then with them having the ability to go back to where they call home. Mm-hmm. I think sometimes people think, again, the inpatient facilities, they're coming to stay. And that's not true based on what you're saying. Mm-mm. That's great. It must really, again, you must see a lot of relief from people in terms of the anxiety that a disease such as cardiac illness can cause. And you're talking about really keeping a handle on that all the way around.
Yeah.
And I'll just mention,
go ahead. Sorry. I was just going to say, no patient or family should ever feel as they are alone in this. We're here with them to help provide the guidance and the support and the expertise to help control that symptom and fear.
Yeah. Mm-hmm. Mm-hmm. Kristen, what were you going to say? Go ahead too. Yeah.
Well, just in terms of collaborating with the cardiology or primary care physician, we actually know with heart failure that those meds that they've been on for some time continue to be helpful, and we continue them in hospice. So that's also a misconception. Sometimes people think, oh, I'll go to hospice and they'll stop all my medications. But no, in fact, specifically with heart failure, we continue many of the medications that they're on any of the medications that they're on that help them for the heart failure. And that's really our starting place. And we work with those medications. it's a very small percentage of heart failure patients with heart failure will have something called advanced therapies, meaning they may have had surgery to have a ventricular assist device, or they may have intravenous medicine that's continuously being pumped to them, even at home. Those are called inotropes. Both of those things, it's rare, but patients do sometimes have those and do come to hospice for us to take care of them as well. And so we have that expertise as well, and try and know that people who've made those decisions to try for and use advanced therapies also need help towards the end of life to be comfortable, and so their family and they will be supported and comfortable.
Yes, the care plans are definitely very much individualized for that patient, what their goals of care or what their wishes are, and how can we help with that.
Yeah, I'm glad you're bringing that up in terms of because there are misconceptions out there, aren't there? And one of them is, again, about taking meds. That's not what hospice is about. Hospice is about living fully for whatever time that person has left. And it sounds like, again, you're doing a great job in making sure that happens. It sounds wonderful, really. And I love that, again, very individualized. There's no cookie cutter, right? It's every individual has different unique needs, and that's being tended to. So, Cynthia, tell us about, this project that you were referring to. I want to make sure it's the NPHI project. So do you want to talk a little bit about that?
Sure. So about 24 months ago, so a little bit before COVID, we were approached from NPHI, which is a national hospice innovation program. It's a national program. It's for not-for-profit hospices. There's about 78 in the country that are involved. And we were selected, along with 5 other programs, to help to develop some standards of care for hospice patients. And the AHA, or the American Heart Association, also endorsed the program. So this is a nationally recognized program being rolled out to our hospices that are NPHI members. It's the first ever collaboration between NPHI and the American Heart Association. And together we're providing standards of care for end-stage heart failure to reduce the use of emergency services and hospitalizations, and increase in-home advanced heart disease and hospice care. So it's a very exciting program. We helped in the development of the program and the educational booklet that you can download from our website. It's very exciting because the AHA has endorsed it, and they have never done that before. Working with hospice, they do recognize that it is an area, end-stage heart disease, that we really need to focus here on, and how to be more inclusive.
Oh, that's great. Yeah, I mean,
yes.
Go ahead, Kristen, jump in.
Well, that's right. And I think the American Heart Association, those are our cardiology colleagues. And the American Heart Association and cardiologists are aware that they need to build they want strong partners, hospice partners and palliative care partners in the community, so that they can continue to really support and care through for their patients through the whole trajectory of the heart failure. So one cool thing about this national initiative is that, and the fact, as Cynthia said, that it's endorsed by the American Heart Association, is that we're really going to try to be out there talking with our partnership cardiology practices and making sure that they know us and what we can offer, and also getting to know them and kind of what their needs are and how we can best support them and their patients and families as they're getting sicker. So it's the fact that the project is a coming together of cardiologists, American Heart Association, and hospice. And that's how we want it and look forward to it functioning as it's rolled out.
Well, that's wonderful. Yeah, everybody should be at the table, right? To enhance that experience for the individual and the family. Yeah. That's wonderful. I mean, cardiac disease is one of the leading diagnoses, right? In terms of health, hospice care, in terms of that provision. Certainly hospice can be provided for any diagnosis, but I think sometimes people that you were talking about misconceptions, Kristen, and people hear hospice, they think cancer. They need to be thinking really cardiac or other, Alzheimer's, other diseases as well. It really is not limited to people just with particular diseases, but this certainly is a big one. Yeah. So, we have a little bit more time left. As always, it never feels like enough time when you're talking about such an important topic. But I just want to check in with both of you because I'm sure you have other things that, you want the audience to know out there. And so the things that come to the top of your mind that you want to make sure you impart before we wrap up today.
I would say that we love to answer questions, and please, feel free to call us if you think a loved one or yourself could benefit from a program. It doesn't cost anything for us to come and see you, explain the program in hospice, assess you for that. It could be that maybe you qualify for palliative care if you don't qualify for hospice. So I wouldn't be afraid to call and ask.
Yeah, great point. Kristen, did you have anything you wanted to impart before we wrap up today?
Well, just to go back to symptom management for a moment, some of my most satisfying experiences caring for patients with heart failure have been when we've been able to assess the symptom and treat it, and the patient kind of trusts us to try it. And they actually quickly say to us, I had no idea how tired I was. Wow. I had no idea how short of breath I was. I didn't know how depressed I was until we really started treating these symptoms and had a chance to do so. And it just is transformative for people when we can control these symptoms. And then it's just really rewarding to be able to do that. So I encourage people with heart failure to, yes, as Cynthia said, engage with palliative care and hospice for help around that so they can really live as well as possible. It surprises people that they can feel so much better.
Yeah, and it's a good point. How do you, there's so much to do at this precious stage of life. How do you even get to all of the things that need to be accomplished when you're in pain or have other symptoms, right? So that has to be first and foremost to get those under control so that we can address some of the other things too, right? The emotional and the spiritual and such. So that's a really important point. I can't thank you both enough. Oh, go ahead, Kristen.
Did you have time for one more thing or no?
Go ahead, jump in.
Well, just one more thing is around what I've also noticed is that a lot of time patients with heart failure haven't had a chance to do advanced care planning. And so they've been so focused and continue to be focused on treating the heart failure, but they haven't had a chance to think what kind of care they would want if they were, very close to the end of life or dying, and to really be able to think about that themselves and talk with their families about that so that that's kind of taken care of ahead of time and families don't have to be put in a position of making decisions without those conversations. So that's another thing that we really, as part of our care, we help patients just kind of take that on in terms of doing some planning. But it's a known gap in patients with advanced cardiac disease. Many haven't had a chance to do that kind of planning. So that's another really important role that we play.
Excellent. Thank you so much. I can't thank you both enough for being on the program. And I want to thank everybody for tuning in to Timing is Everything, program of Care Dimensions. My name is Mary Crow. And again, just happy to have you here. And thank you both so much for being on the show today.
Home. More than ever, it's your sanctuary. But if you're caring for a loved one with advanced illness, it can feel isolating and worrisome. Care Dimensions can help. As Massachusetts' leading hospice provider, you can count on us for guidance, medical care, and support. We follow all COVID-19 safety precautions to protect you and your family so you don't have to delay getting the care you need. Visit Care Dimensions online or give us a call.